you. And it has a reminder for those of you who are just joining. If you haven't already, if you could put your name and your organization in the chat so we know who's here with us today, that would be great. And actually, before I begin, can we go to the polling? And that, okay, before we begin, and to give the presenters an idea of who we have in the room today, our first polling question is, what type of organization are you representing today? Is it a government agency, a municipality, a nonprofit agency, excuse me, a private for-profit? Are you a private citizen or other? And if you choose other, if you could put in the chat who you represent, that would be great. And I will just give you a couple of, I used to say a couple of minutes, but that's a long time. So I'll just give you some time to enter your answer. Okay. And as a case, could you put the results back up? I kind of clicked out of it. Okay. Thank you for answering the question. So 73% of you here today are from nonprofit agencies. We also have a government agency. Laura is from Copa Health. Thank you. Government agencies, we do have municipalities and other, and private for profit. I'm glad to see you. And I put MPO, I put other because I'm MPO. Were there any others besides what we have on the ground? Valley Metro definitely is here today. Okay, so I would like to move on to providing an overview of the agenda for today and the topics that we have for you. So today we have updates from Valley Metro. We do have updates for the City of Phoenix, public health updates. We have Care First Arizona providing a presentation and heat relief rides. We also have an agency spotlight from Hope Inc. I'm sorry about that, it is Hope Inc. today. And then we will have some human services transportation updates and some regional mobility managers updates. So thank you for that. Thank you. Okay, so before we get to our Valley Metro updates, I have another polling question. And if we could bring that up. Do you or your consumers use public transit? And I don't know if is that a polling question? If we can, thank you. So do your consumers use public transit? The options are, I use public transit, bus, light rail. My agency's consumers use public transit, such as bus, light rail, or my agency's consumers use Dial-A-Ride. And neither consumer nor I use public transit. May we answer more than one? Yes, please. So I'll give you some time. And I am actually going to use this. I use public transit, light rail. And we're very lucky here at MAG that we have actually a light rail station right in front of our building. Okay, and so the results are that, wow, 54, both for my agency consumers use public transit and they use Dial-A-Ride. That's great. And thank you for those of you here today who use public transit. That's great. And then we have 27%. Neither your consumers nor you use public transit. And we definitely know that public transit is a transportation option that is here, if your consumers or yourself are able to take it, if it's appropriate for you. It is a transportation option that is pretty reliable. There's, you can see the bus stops, you can see the schedules. So we're really happy to have a great partner in Valley Metro to our program. So I would like to welcome our first item on the agenda is Valley Metro updates, and I would like to introduce Guillermo Gonzalez from Valley Metro. Thank you.
Thank you, Dee Dee. Please bear with me. I'm a little sick, so you may hear some coughing in between. Yeah, we have Valley Metro updates. Here at the meeting also is Trevor Ebersol. He's our paratransit and ride choice program supervisor. Next slide, please. So here's the ridership numbers. As you can see, it looks like ridership is decreasing, but in actuality, ridership is increasing compared to last year. Ridership does start to decrease a little bit as the heat rises, but these riderships numbers are considered more flat than declining. Next slide, please. October 2023 proposed service changes. So the comment period for this has already ended, but I wanted to kind of give you an overview of the proposed service changes that are being sent to our board. On the first one here, as you can see, they're going to be modifying the weekday frequency from, I'm sorry, they're going to be modifying the weekend frequency from 20 minutes to 30 minutes from 6 a.m. to 7 p.m. on the zero route that goes up and down Central. Next slide, please. Here, they're going to be modifying the weekday frequency to every 15 minutes from 6 a.m. to 7 p.m. between 35th Avenue and 32nd Street, and extend 15-minute frequencies to 44th Street. This is happening on Route 3. Next slide. Great. So on Route 7, going up 7th Street, they're going to modify the weekend frequency to 15 minutes from 6 a.m. to 7 p.m. between Dunlap Avenue and Baseline Road, and 30 minutes north of Dunlap Avenue and south of Baseline Road. Next slide, please.
Bless you.
All right. On Route 16, they're going to increase the weekday frequency to 15 minutes from 6 a.m. to 7 p.m. between Baseline Road and Northern Avenue. Next slide, please. Route 19, the proposal is to increase weekday frequency to 15 minutes from 6 a.m. to 7 p.m. for the entire route. Next slide, please. Route 27, again, we're going to be increasing the frequency to 15 minutes from 6 to 9 a.m. and between 3 and 7 p.m. between Bell Road and Lower Buckeye Road. Route 35, we're going to increase the weekday frequency to 15 minutes from 6 a.m. to 7 p.m. between Lower Buckeye Road and Metro Center Transit Center. All right, next slide, please. Route 70, again, we're going to increase the weekend frequency to 15 minutes from 6 a.m. to 7 p.m. between Baseline Road and 43rd Avenue. Next slide, please. Here, this is the downtown Phoenix Dash. We're going to extend the route to Roosevelt Street and 3rd Street and add weekend service between Roosevelt Street and Jefferson Street. What this is going to do is it's going to help connect downtown and the Roosevelt area. So from the stadium all the way to the Roosevelt Art District. Next slide. Route 44, I'm going to extend the route to Rio Soldado Park to Mesa Riverview. What this is, it's going to be extending it. Tempe Marketplace is going to be having people be able to connect both shopping centers. So the Mesa Riverview Shopping Center as well as the Tempe Marketplace Center. Next route, please. Next slide, sorry. So the proposed changes in the West Valley, Avondale will be eliminating the Zoom, and Peoria will be eliminating the Pogo. Next slide. So because the Zoom is being eliminated, the Avondale area has what we call WeRide, and this is the WeRide service area. WeRide is a microtransit. So this microtransit is open to the public. It'll work similar to a demand service within a certain area. So it's going to be blocked in to the service area that you see there. Okay, next slide. The fare collection system modernization project. So I don't know if you guys that use services, but there's a lot of things changing with the fare systems. First thing we want to talk about is our mobile fare app and the fare progress. So downloads are still increasing, which is great. And as you can see here, these are the ratings that we have currently right now with Google Play and Apple Store. We're on the higher side of 4 stars, which is great. Next slide. Here's a heat map of passes being scanned using the mobile app. Between 3,500 and 4,000 scans on bus per day, lower on the weekends, roughly 300 to 500 on light rail. The biggest dot is 44th Street and Washington Light Rail Station. Lots of usage. There's lots of usage along Central Avenue and in Tempe. The bus dots are similar because even though they have more passes scanned, they are not condensed to one area. So as you can see, the light rail looks like it's a bigger blob, but that's because it's all condensed into those specific stations, as compared to the bus routes where it's like a little dot in the different areas. So that just kind of shows you a little blip of how many bus stops we have all around here, connecting everybody and hoping to connect communities and enhance lives. Next slide, please. So what's next? We're going to be adding a few features. We're going to be adding rider alerts. Notifications and satellite views should be out in early July. The reduced fare application website that is not going to include medical and substance abuse will be active as well. And there's going to be outreach events to help sign up people for reduced fare and information about the major changes in the fare system. So one of the major changes with the reduced fare is that we are going to, in order to be eligible for more than just 1 day reduced fare pass, you're going to have to be signed into the reduced fare program. This includes students and seniors, so that if they want to continue to use reduced fares, they're going to have to sign up. And that's why the website is coming up. There will be outreach events where they will be signing people up at these different locations. More information is to come as these projects are being completed. Next slide, please. So paratransit, we have some really fun and exciting software reservation modules coming to our Valley Metro dial ride service, or sorry, Valley Metro paratransit service. Excuse me. Next slide. So what we're going to have is what is called PassWeb, Easy Wallet, Notifications, and Pass App. PassWeb will have a customer have an online portal. Easy Wallet, digital wallet notifications, customers will receive notifications when their buses or rides are coming. And Pass App is a mobile app for the customer portal. Next slide. So PassWeb, the reservations are still going to be the same from 6 a.m. to 7 p.m. However, they're going to be able to do this online, so they don't need to really call anyone or wait in a queue, being on hold ever. They'll also be able to, at the end of the year, excuse me, we have a lot of customers that request trip reports, request their ridership that they've done through the years for tax purposes. They're going to be able to see all of their trip reports, be able to print them out on demand whenever they like. And they're going to be able to see all of their scheduled trips as well, be able to modify, change them, and cancel them via our online portal. Next slide, please. Our Easy Wallet is going to be part of the PassWeb portal. This is basically going to be a digital wallet that Valley Metro is going to have. The methods of payments that Valley Metro is going to be able to accept is going to be cash, tickets, the monthly pass for Phoenix residents only, and Easy Wallet. So we're introducing Easy Wallet. So how would you load your account? Well, you'll be able to load your account with a Visa, MasterCard, American Express, debit, and an electronic check. So we're looking at we're looking at giving people the ability to load their account with money so they don't have to have cash on them at all times. Because sometimes it is hard to get $4 exactly because our drivers do not have change. And we also are offering what's called an auto top off. So if a customer only wants to have $20 at a time on their digital wallet, when it goes down to about $10, it can bump it right back up to $20 automatically. So that'll help the customer experience and alleviate some hardships that people have when they can't get to the bank or they ran out of paratransit tickets. They'll be able to load an Easy Wallet. Next slide, please. Notifications. With our notifications, there's not going to be any changes, but we are switching to a new software. This new software is scheduled to be implemented sometime this late summer. They're still going to be receiving the notifications the day before and the imminent arrival 10 minutes before the arrival time. Next slide, please. Now the Pass app, that is basically an application that's going to be on your phone. That is the customer portal. So instead of going to the actual website, you'll be able to access the same I guess features that Pass Web has, but it's called Pass app. You'll be able to access that through an application on your phone, and you'll be able to access Pass Web and Easy Wallet there. So you'll be able to load your wallet, digital wallets, check your trips, look at your schedules, and everything's going to be in the palm of your hands, similar to the Valley Metro app when you have certain rides that you are trying to do or checking up on the passes that you've purchased already. Any questions? Yes, Sam?
For the We Ride in Avondale, how much is that? What's the cost on that?
I don't know yet. I can find out in 2 seconds. Give me 1 second. Sorry, I mainly work with paratransit. $2.
$2 for any one-way ride?
Yes. So this is the regular adult fare starting January 3rd is going to be $2.
Wonderful.
And
And
then
then follow-up
seniors, veterans, disabled, and students currently registered at EMCC and Franklin Pierce may pay a reduced fare of $1. Okay, any other questions?
I have one. I'm sorry, I missed it. When is the paratransit website going live? For the app, I'm sorry. The app, like with the digital wallet and all that?
Oh, the app, we are not going to be working on the app until after the Pass Web and Easy Wallet are installed. We are currently working on that. We're hoping that that is completed towards the end of summer.
Okay, thank you.
And once it's completed towards the end of summer, we'll start working on the app. There's a question that was brought to the text. Is this, will the software be blind friendly? Yes, it will be 100% accessible. That is part of what we are looking for, and we're making sure, and we actually have VMAG members that will be testing it as well that are vision impaired. Any other questions? Yes, Sam?
Hi, so as you're talking about the reduced fare application program, I was looking that up alongside as you were speaking, and I came across this homeless service provider program. Are we eligible to provide to apply for the reduced fares on behalf of our clients?
Your clients have to apply themselves because we need their signature. So they'll have to show depending on the status of what they're applying for. For reduced fare, they have to have a disability. They have to either be veterans with 30% or more disability, they have to be going through a substance abuse program, and that is only once in a lifetime that will accept that. And it's for 1 year, I believe. You have to have a disability, and you can show your SSI award letter. You have to have a Medicare card or a senior. You have to be a current student, or you have to have a disability with a proof of your disability through doctor's letter. So there's different processes that are required for reduced fare. But yes, and the program is changing a little bit, and our cards are changing as well. So the current reduced fare cards that are currently out there, they're not going to become invalid, but they won't be able to use them with the new system to purchase reduced fare more than just one ride. So they'll have to switch over to the new cards in order to purchase a week pass or a month pass or something like that. Any other questions? Okay, great. Next slide. I do want to invite you to our Valley Metro Accessibility Advisory Group. This is a meeting that we have every other month. Our next meeting is in July. It's the 4th Thursday of the month. And what we do here is we talk about accessibility issues within Valley Metro. So our accessibility advisory group, they actually set the agenda up themselves. They tell us what they're interested in, what they want to learn about. And then we seek their input on our various projects. For example, our notifications project, we're setting up the notifications project, but they're still the final testers. So if we send out the notifications and something's wrong and they can't see it, read it, understand it, it won't go live. So it's we do use VMAG for a lot of our various projects. One thing that we are very proud of our group is that recently there was a textured floor that they were planning on using at the new light rail station at Metro Center. And the textured floor was undetectable with a white cane. And our Valley Metro Accessibility Advisory Group went there and they had no idea where to find it. That was very eye-opening, and they had to go back to the drawing board to fix that, because that was something that was brought to their attention. Because we have every intention of making things accessible, but sometimes we're too close to our projects and we need an outside view. And that's where our advisory group really helps us. Next slide, please. So the people that are eligible to apply for our advisory group are seniors 65 and older, a person with a disability, a caregiver for a senior or a person with a disability, or an employee or a volunteer of an organization which serves seniors and people with disabilities, which is everybody here, which is really amazing. So I invite you to participate or even apply and become a VMAG member. Just remember that we do take into account all modes of transportation, and also we take into account Title VI. So when we say all modes of transportation, we're not talking just dial-ride and paratransit and ride choice. We're talking all dial-ride services within Maricopa County, light rail, streetcar, the commuter buses, as well as the regular fixed route buses. So it's all modes of transportation that we're using, as well as anything that we use in order for you to use our public transit system, for you to be able to use it. So the accessibility of our website, the accessibility of our applications and all of that, to help us and give us insight to that, or just kind of learn a little bit how we're being accessible, and maybe we're missing something, and it could be brought to our attention and we can make it even better. Through this advisory group, we found out that our ADA application was accessible, but it wasn't the most accessible. It was a little harder to navigate with a screen reader. So we made it easier to navigate because of some public attendants from VMAG let us know about this. So once they let us know, we started the ball rolling to make sure that this doesn't happen, because accessibility is very important to us here at Valley Metro. Next slide, please. So how to apply? You can go to valleymetro.org accessibility advisory group, or you can just go to valleymetro.org and click VMAG, and then the site will come up. If you have questions regarding VMAG, you can always email us at vmag@valleymetro.org. You would need to fill out an application, and there is an interview with our VMAG members to see if you are eligible to or would be a good candidate for our group. Next slide. So if there are no more questions, that concludes my presentation. Okay.
Do we
Hi.
Hi, Guillermo. Was Trevor going to present also?
Trevor, I had Trevor on standby in case my voice
Okay.
went out.
Okay, thank you. And again, does anybody else have any questions for Guillermo? Definitely, thank you. And has our polling results showed that 50%, over more than 50% of you either take public transportation or consumers take transportation, or there's a combination of both. So it's always, we're always thankful having a great partnership with Valley Metro. We know, again, you are another transportation option that is available. Not only with buses, you know, now we have light rail, we have there's also those I just drew a blank. There's shuttle services too. So thank you so much for your presentation. And now I would like to go to the next polling question before our next agenda item. And the question is, are you a Section 5310 subrecipient representative? Yes, no, or no, but would like to have more information. And if you do put no and would like more information, please put your contact information in the chat, and either Zacchaeus or myself will contact you. Okay. And thank you again for participating in our polling. And we were getting 84% of you today are a 5310 subrecipient. 13 no, and then we do have somebody who is interested in more information. And again, put your contact information in the chat and we will get in touch with you. So this update, we're very happy to have Wendy Miller with the City of Phoenix to provide City of Phoenix updates. Wendy Miller is the Federal Grants Administrator with the City of Phoenix Public Transit Department and our designated recipient representative who will provide updates on the Section 5310 program. Thank you, Wendy.
Thank you, Dee Dee. Good afternoon, everybody. Thank you all for being here. This is one of those times of year. It's hot out, it's summertime. And all of the hats that I wear, besides working on the 5310 program, have been super, super busy right now. So I do not have a considerable amount of updates for the 5310 program. As most of you know, back in February, all of the current grant applications were due. Those projects are currently going through the MAG process for approval. And everyone should be receiving information if you applied probably within the next 30 days. So that's one thing that's coming up. What we're doing while MAG is busy doing their part of the process, is we are still researching, trying to find appropriate vehicles for our vehicle program for purchase. We've been working on notifying our 5310 recipients that have outstanding funds that they need to submit reimbursements for. We've been just working on some cleanup of the program and making sure that we're ready to go. We've been doing a lot of work on vehicle disposals. So for those agencies that have vehicles that have met the end of their useful life, or if they've been in an accident, they need a replacement, and some of those issues, we've been working feverishly on those. For any of you that have been working with us on a vehicle disposal, we just wanted to let you know that currently, because of a lot of the end of year activities with the Federal Transit Administration has a lot of their approvals being backed up a bit. So some of you have been waiting very patiently for FTA to approve of a early release of a vehicle, and that's been taking some time. So we do appreciate your patience. We are getting to it. We are working with them. We are getting updates, but it may just take a little bit of extra time. So we appreciate your patience on that. And with that, I'm going to open it up to an opportunity if any of you have any particular questions for me at this time. And Dee Dee, let me know. I can't see the chat. So if somebody's asking a question or raising their hand, please let me know.
Definitely, Ezekis and I can take a look at the chat. And I would just also like to recommend that if you receive communication from Wendy at City of Phoenix staff, please make sure that you do respond, whether you have the information now or you're gathering the information. I think is really important to have open communication with the City of Phoenix.
Thank you, Dee Dee.
Okay.
And with that, my presentation is done.
Okay. Thank you, Wendy, great partnership. I appreciate you being here today. Okay, we will move on to our next polling question. And the next polling question is your agency back at full capacity? Yes, you're back at full capacity, or you're still in the process of being back in full capacity. Not quite back at full capacity, or never reduced capacity, which I'm surprised a couple of agencies have been open during this whole time. So we just wanted to get an idea of the environment that we're working at with our consumers.
Dee Dee, I have a question. Sorry, this is Guillermo from Valley Metro.
Hi, Guillermo.
When you say full capacity, what exactly do you mean? Do you mean our services, or
Yes,
do you mean that our employees?
it's services. Yes, definitely. Thank
okay.
you for that clarification, Guillermo. Yes, it's your services. And thank you for your response. And again, it's pretty, people are still in the process of being back at full capacity, opening up, and then 45% are at full capacity. Only 5% said you're not fully back at full capacity. And like I said, 3% never reduced capacity. And I think this is really an important question to know where we at with our programs. I have a comment in the chat that's DEC never closed during PHE, but we're struggling with finding qualified staff and enrolling new members. Thank you for that. Like I said, there were a few agencies that didn't reduce services. And I think this is really important for our next presenter. As we see agencies continue to open up again, it is important that we keep healthy, also that our staff and our consumers are continue to be healthy. And I'm not quite sure if a summer code is a real thing, but to ensure we are all updated on summer health items, we are so pleased again to have Lori Thomas, who is the manager of Healthy Aging, to provide information and updates from the Maricopa County Department of Public Health. Thank you, Lori, for continuing to be a presenter here.
Thank you. And thank you for having me. I do have just a few updates for community partners. And if you want to go ahead and move the slides along, that would be great. We have a little bit of data for you on COVID. I know some of you may be thinking, not really. Oh, we're going to talk about flu first. Here, you can just see that these are laboratory confirmed influenza cases in Maricopa County. And we are seeing that fall dramatically, and it is not the same as it was in previous past months. So we are seeing that drop off. And so you can also see that the current flu season, there's in the dark turquoise, and then the other 5 seasons average is in the dotted blue, and then the 2021 season is in that variegated line. So you can see we are doing much better than we have in the past. Okay, next. The flu, you can see that the predominant virus is now in the green. That's the green one that we are experiencing. And that's flu B. And thank you for pointing that out. That's the predominant one that we have been seeing. So right now, people are formulating the flu vaccination to be the flu B. Well, that's what will be in the vaccination. Next. Now we do have influenza-like illness, and you can see this pretty much the same as the other. Our current season is in the turquoise, and you can see that we are a little bit lower than last season. And you can also see that 5-season weekly average before that baseline there with the variegated line. Okay, next. This is the epi curve for COVID-19 in the last 60 days. And we do have the indication is it's all going down. I do want to let you know as we go into the next few slides that COVID is still around, and you'll see that on the national numbers, maybe more than ours. People are still dying and being hospitalized from COVID, but this is what we look like in Maricopa County as of 6/13. Okay, next. Okay, here's the CDC COVID data tracker, as I just mentioned, for the entire United States. Hospitalizations are down 7%, which still meant there were 6,649 hospitalizations, and deaths were up by 1.2%. Due to COVID-19, but the trend in the past week was down 7.7. But you can see at the very bottom, total number of deaths were 1,132,000. And there were vaccinations there as well. Okay, this is data through the 10th. New hospital admissions of confirmed COVID-19 were 115 in Maricopa County, and that was down 16% from prior weeks. New COVID hospital admissions per 100,000 populations was up 2.1. And we are considered at a low level at this time, and we're all grateful for that. Next. Okay, this is from Maricopa County. This is our website. We'd love to have you go to that if you're interested. That's www.maricopa.gov/5786 COVID-19 data. And you can go on there and check the hospital admission level or the summary dashboard or the Maricopa County vaccine data. And you can just go on there and check that out if you'd like to. And I will just see if you can see that. No, I cannot see that. So let's go back here. Whoops, it looks like I got us out here. Hold on. Okay, what did I do here? Let me get me back with you all. I was trying to be fancy there. Let me just try to get back to my Zoom. Here we go. Sorry, people. Okay, what did I just do? Okay, can you hear me?
Yes, we can. Yes, we can hear.
Well, why I am not seeing, can you go to the next slide? Okay, these are the variants for Maricopa County. And the most popular variant right now, and I shouldn't say popular, but the one that is around the most is what we call XBB. And that is what all of the scientists right now are formulating for the vaccine. That's the one that they are going to be trying to utilize because that's the one that is appearing the most often. So that's the one you'll see in the vaccine. Next, let's talk about extreme heat. These were the 2023 heat-associated deaths. You can see in 2022, there were 4 confirmed, 44 under investigation. And in 2023, so far, we've had 5 confirmed with 28 under investigation. These are serious, and we see more and more with people that are not sheltered. Next. Here we go. You can take a look from 2012 to 2022. These are Maricopa County identified a total of 425 heat-associated deaths occurring in 2022, and that's a 25% increase from 2021. So we are, many organizations are trying to tackle this at the same time. Cities, counties. Now, how do we stay safe in extreme heat? The website resources, of course, there are cooling centers that you can go to that are free where you can get water and shade. There are heat reports that you can look to, heat alerts, fact sheets, and using common sense. We, of course, don't realize how much our bodies perspire, how much we need to hydrate, how much we lose in the heat. And of course, all of those people that visit our area don't have any idea the trouble that they can get into when they get into hiking. And it's interesting because there are also many people that have lived here a long time that get into trouble on hiking trails. So we are going to see this year, as I understand, a late monsoon season and a dry monsoon season. So we're going to be seeing more extreme heat. Next. This is some fentanyl overdoses. If you can believe that figure, we've increased by 6,000%. So the death rates for natural semi-synthetic synthetic opioids and heroin have remained relatively stable. However, the death rate for synthetic opioids has increased by over 6,000%. Everyone is concerned about this. We have received monies from the federal level and from drug companies through different lawsuits to address some of these concerns in opioids, and those monies are being sent down to different organizations, and plans are being made in how to address this issue through many organizations, not just the county, but states and hospitals and many other organizations. But it is a great concern. Next. Vaccines and therapeutics. Go ahead with the next slide. Staying up to date on all vaccines. We recommend that XBB booster for fall. That's the one where that is the variant that is showing up so much. The CDC website has all of the vaccines and recommendations for individuals 65 plus and immunocompromised individuals. If you are not familiar or you're confused about what type of vaccines you or your children need, you can call the CARES team at Maricopa County Department of Public Health, and they can direct you to free vaccine clinics at the number 602-506-6767. Next. These clinics are free all the time. West Valley, Roosevelt, and the Mesa Clinic. And their hours are 8 a.m. to 4:30, Monday through Friday. And you can always call the CARES team and have those addresses given to you over the phone. Next, and they'll make the appointment for you if you'd like. Next. Mpox used to be called monkeypox. It is now referred to as Mpox. And it still is rearing its head, not as much as it was, but we did have a case. And for those who should be concerned and have are at risk, persons who have sex with more than one partner, and persons who have sex at a commercial sex venue. And we need to focus on safe and healthy spring and summer. And the CDC has many resources on this. There is an immunization for this, and this is offered at Maricopa County Department of Public Health at our clinic on Jefferson and some of on Roosevelt, I'm sorry, and also at some of our other clinics. So if you want to call the CARES team, you can get that address and get an appointment for that. Next. Other kinds of diseases that public health tracks, just for your basic knowledge, we do have all kinds of other foodborne illnesses, heat-related illnesses, hepatitis, influenza or flu, Mpox, salmonella, STDs, swimmer's itch, tuberculosis, valley fever, as you can see, COVID-19, all kinds of other viruses that you may have heard of or don't want to hear about, rabies, mosquitoes, Lyme disease, Rocky Mountain spotted fever, West Nile virus, dengue, St. Louis encephalitis. We track all of these and try to understand them. And when there are outbreaks, we use our epidemiologists to find out where they are and to investigate them and find out how we can shut those down and why they are appearing. Next. Our epidemiologists are always busy. At this time of year, we have a lot of mosquitoes, as you're finding. There are 3 R's that we refer to. Make sure that you are repelling mosquitoes. Cover your skin and use repellent on exposed skin when outdoors at all hours. It can be morning, noon, or night. Remove or get rid of standing water where mosquitoes can breed in toys and flower pots, fountains, dog bowls, anything that can hold any amount of water. And repair or fix holes in your screens so mosquitoes can't get indoors. So those are the things to remember is repel, remove, and repair. Next. Other public health resources. The CARES team, they speak English and Spanish and would love to speak to you. Oh, excuse me. We have these bookmarks available and would love to mail them out to you if you would like them. And we want to be your resource for all things public health. Are there any questions? Is anybody awake?
Lori, I do have a question. You mentioned that the XBB booster is recommended right now.
Yes.
Is it recommended for older adults and the population in higher risk, or is it recommended to the population in general?
Both. It is recommended to both. It is 1 shot. So it is not 2 doses like in the past, and it is recommended for both. You can talk to your physician and ask if there's any reason that you should not, with your conditions, take this, but it is recommended for both. I see there's a question about Narcan being available on public transportation. Do drivers carry that? Many organizations are supplying Narcan, which of course is it's an if someone is has taken opioids, and it's an antagonist to having taken an opioid and can bring you back. I don't know, perhaps Guillermo can discuss whether that's available on public transportation or not. There are two different types available. There's an injectable and there's a nasal. So if Guillermo, or if you're there, maybe you can let us know. It's a good thought. It is a good idea for those that have a friend, relative, someone that has an opioid issue, to have that in your home. I do have both kinds in my home, and I did feel uncomfortable with the injectable, so I signed up for a class to be able to administer that. Didi, I think maybe Guillermo is no longer there.
I'm sorry, I was blowing my nose. I apologize.
Oh, okay.
I'm sorry, what was the question?
The question is Narcan available on public transportation for perhaps bus drivers or people to use if someone appears to have an overdose of an opioid?
I don't know.
Okay.
We don't know, but we can find out. I don't think it is.
Okay. No, it was just a question by someone, a good thought. But there are two kinds, the nasal and the injectable, and I think probably some people would feel more comfortable with the nasal application.
Yeah, and I want to say that if you want to have one at home, there are organizations that provide those for you at no cost. I know because I literally just received one 2 days ago from
Yes.
Sonara Prevention Works, and I have one at home as well.
Great, great. Well, when you saw that figure of 6,000% increase, it affects so many of our family and our loved ones, and it would be great to be able to assist in cases of emergency. Anyone else out there have any thoughts on that?
Lori, I do have a question off the subject, but we have a question from Wendy. Are COVID boosters still recommended every 3 months?
With the new one that's coming out, that one I don't think will be every 3 months. I think there'll be new recommendations for that. So I think, and I probably should not speak out of turn for this because I'm not sure when that one is going to be available. But you could call the CARES team or call your physician, because I'm not sure when that one is going to be available. With the new, it's what they call a, let me just see if I'm saying this right. It is a monovalent COVID-19 vaccine with an XBB lineage of the Omicron variant. Is that a mouthful? And so the FDA just approved that for an updated vaccine beginning in the fall of 2023. So I think we have to kind of wait and see what the recommendation is for that, because it may not be every 3 months for that one. And that's probably about the best I can do for you at this time. And monovalent really means it has one kind of antibody, for those of you that are interested. So, and that's about all the knowledge I have on that. Any other?
I just found out about sorry, this is Guillermo, about the Narcan. It is not on our buses, light rail, nor our security.
Okay. Okay. I think as as this awareness continues to increase and the incidents increase, you'll find it available on it and people being trained on it, and it will become more available in places. So that's something to look at. Well, if no one has any other questions, thank you for letting me visit with you about healthcare updates. Stay safe, stay cool. And I know that the animal control would love me to give you a little plug here that would say, keep your pets safe over the 4th of July, because a lot of them are very, very frightened by fireworks and run away if they're outside during that time of fireworks. So be careful and keep them safe and indoors. Thank you so much.
Laurie, thank you once again for presenting at our TAP meeting. You're a wealth of information. And I just want to remind everybody that we will have our presentation and the webinar available on the MAG website. So thank you so much for your time today.
You're welcome. Bye.
Bye. Well, thank you. So our next agenda item, one of the goals of our Transportation Ambassador Program is to provide you with information and resources to assist you in the work that you do. And we are pleased to have with us today Mauricio Orozco and Sonyoung Pak to provide information on Care First. And actually, I see Allison's name on the presentation. So welcome, Allison.
Thank you. Both Mauricio and Sonyoung had some priority things come up today, so I'm filling in for them, but very happy to be here and happy to talk to you all about redetermination. So my name is Allison Pouch. I'm the Senior Manager of Provider Network at Arizona Complete Health. Under Arizona Complete Health, we have both Arizona Complete Health Complete Care Plan and Care First Health Plan Arizona, which are a couple of the Medicaid MCOs here in Arizona under Access. So Arizona Complete Health Complete Care Plan serves the southern region and central regions, and Care First primarily serves the north, but we work in tandem on a lot of different initiatives. And one of our biggest ones that we've been working on over the past couple years and really in full force in the past couple of months is redetermination. And I'll go into a little bit about what that is, kind of what we're doing as a health plan, and then what you guys can do to help out and assist as far as messaging, should you guys get any questions from folks. So for Medicaid members, staying enrolled and covered under that access coverage can be challenging, and losing coverage is very common. There is a constant cycle going on of members coming off and on that coverage, and we know that as Medicaid churn. What happens when those members fall off and on all the time is can be care disruption. There can be health outcomes that fall down and get worse, and then there can also be higher healthcare costs. So we really try to help encourage members maintain their Medicaid coverage on a constant basis. One of the ways that members lose their Medicaid eligibility is they forget to renew their coverage. You can go to the next slide, please. Thank you. Over the last couple of years, and really at the start of COVID, what happened is that Access put a pause, and really this is nationwide, all of the Medicaid healthcare coverage states put a pause on disenrollment, meaning they would still outreach members to renew their coverage on an annual basis. But if a member didn't respond, or maybe they were higher, had higher income levels that made them ineligible, they still were able to maintain this Medicaid coverage because of the pandemic, because of COVID, because of the public health emergency. So with the recent enactment, though, of the Consolidated Appropriations Act that happened back in 2022, all of the states were able to resume their normal renewal processes. So Access, which is our state regulator, began their normal renewal process for Medicaid and Kids Care members, and that went into effect as of April 1st. So at that point, Access began disenrolling any member who had no longer been eligible for their Medicaid coverage. So quite a few members have been impacted. Over 600,000 Access members across our entire state of Arizona are potentially in danger of losing their coverage because possibly they're no longer meet eligibility criteria, or they've not responded to requests for information to determine them eligible. That's a lot of members across the state who could be in danger of losing their healthcare coverage. So we want to make sure that we have a lot of things in place to help encourage members to prepare for these renewals that are going on right now. May 11th marked the end of the public health emergency, but Access did choose to begin disenrollments just slightly earlier than that as of April 1st. Next slide, please. So here's some information about what happens when Access does their eligibility determinations. Approximately 75% of those are completed automatically. This means that members do not need to take any action. The state regulator, Access, sends a summary letter that says, if everything's correct here, you don't need to do anything. You don't need to call or contact Access. You're automatically renewed for the next year. And then they get that automatic eligibility renewal for the next 12 months. Some members are not able to go through that automatic process. And so in those instances, Access needs additional information from a member to determine if they're eligible. And so in those cases, Access will send a request for information letter that says, hey, we need this information so we can determine your eligibility. We need it by this date, please respond. And so those instances, members need to turn around, supply that information to Access, or they may request more time by calling that phone number that's listed right there to help with the process. Next slide, please. We're doing quite a bit of outreach efforts at a lot of our, similar with the other MCOs, Mercy Care, United, Banner, those are following some pretty close strategies to us. But what we're doing a lot of outreach to members. We get a list of members from Access on a regular basis about who's coming up for renewal and who may need assistance. And so in conjunction with Access, we're really reaching out to these members and directing them on what they can do to prepare for all of this. Next slide, please. So ways that we're trying to outreach members are emails, texts, newsletters that we put out to all of our membership. We have updates on our website. We do hold messages for our customer service. We do quite a bit of to various venues just to really try to get awareness out, and really the communities as a whole to really encourage members preparing for this and giving them information on what they can do. Thank you. A lot of direct calls. So not only are we doing those, kind of indirect methods by email and text and things like that, but we're doing a lot of direct calls. Our health plan staff are taking time out of their days to call members directly and give them information and education and make referrals if they need to. We're doing a lot of targeted outreach to various populations, including those who are under care management, those who may be homeless, those who have veteran status, those who have chronic conditions and really need assistance in maintaining their coverage. We're also utilizing a couple of community assister organizations. These community assister organizations are trained to help members with the renewal process, as well as help them navigate other healthcare coverage options. And I'll go into that a little bit more here in a few slides, but really are utilizing some community assister organizations to help us do direct calls and really try to reach as many members as we possibly can. And then on our health plan staff, we have a couple of those community assisters too, who can help assist. Next slide, please. We're also relying on our provider network. They're a really valuable resource for us. They have that direct day-to-day contact with coming into their offices for visits and treatments and therapies and things. really, we wanted to get the word out to our provider network. So doing a lot of presentations, different forums and meetings, there's available. We're doing communications, have our provider engagement to providers, kind of office visits, and then sending out lists of members that our provider network to in their offices. So we're really relying on our provider network to help get the messaging out to our members as well. Next slide, please. A lot of community partners, so things that I'm doing with you all, providing general information to various community meetings. We try to collaborate with a lot of agencies. We're part of a few coalitions surrounding the return to renewals, otherwise known as unwinding. Our teams are engaged in various community events, linking Vitalist Health Foundation to the Arizona Library. We have an Arizona Stakeholders Broadband Network, connecting with schools, libraries, community events, health fairs, all faith-based organizations and veteran organizations as much as we can to, again, just try to get the word out as much as possible on what members can do to prepare. Next slide, please. All right, so our key messaging that we're trying to get out is really just reminding members to be prepared. So we want to make sure that we remind them to have their contact information up to date with Access. It's really important that Access has their current mailing address, their current phone number, their current email address, because that's how Access is going to be reaching out to the members for those eligibility letters. It's really important that members be checking their mail regularly. If a member isn't checking their mail, they probably don't know that they're getting letters. So we really want to encourage members to be checking their mail regularly. And then should a member get one of those letters that request them to respond, it's really important to remind members that they do need to do that. They should respond. They should provide that information so that Access can review their eligibility and determine if they do, in fact, can maintain their coverage. And then should a member need assistance with this process, it's very convoluted, it's very confusing. It can be a little bit hard to navigate some of the Access systems, which is why we want to encourage them, if they need it, to get help from community assisters. So those are those agencies that can help members with renewal and help them navigate other healthcare coverage options if needed. So healthyarizonaplus.gov is a key website that can be utilized for members to use. That's the portal that Access uses to update eligibility information, where members can go to update all of their contact information, and members can just view general information about their eligibility spans. Members can also contact customer support line, that 1-855-HEA+ phone number. So that's just a direct call number that helps them link with that healthyarizonaplus.gov website. And then coveraz.org, or the number listed there, that 1-800 number. Members can visit that or call that number to get a list of the community assister organizations in their area. So if a member needs that community assistance, they can go to that website or call that number and find a community assister in their kind of zip code or in their city or in their kind of certain area where they're living that they can get assistance for. Next slide, please. So we are going to find that members are no longer going to be eligible for Medicaid. Maybe they've met that income threshold, or they've had a change in their household, and they may no longer be eligible for Medicaid, but they still need to maintain some kind of healthcare coverage, right? So they need some type of health insurance to help them with their, regular visits, or, when things come up where they need services or treatments or things like that. And so we don't want to just say, okay, you're done, you're no longer eligible for Medicaid, goodbye. We really try, if a member is no longer eligible, we want to try to connect them with resources to get connected with those other healthcare coverage options. So there are marketplace lines of business available. There are Medicare lines of business available. members can go to healthcare.gov to kind of find a whole gamut of information about all of the different types of coverage options they have. But we also here at Arizona Complete Health have a couple of options available should a member be interested in exploring those. So we have an Ambetter from Arizona Complete Health marketplace plan, and then we have WellCare by ALWO, which is a Medicare plan. So certainly those are options available if a member wants to explore what's out there, what they can do. And certainly those community assister agencies are trained in helping members navigate those marketplace and Medicare plans too, and can give them information and resources about how to get connected. Next slide, please. This is just some general messaging that we give to our providers. So, we like to encourage providers to be reminding members to go to that healthyarizonaplus.gov website. We like to encourage providers to check Access Online for eligibility prior to rendering services. That helps trigger those conversations with members and providers about the redetermination process. Next slide, please. And then this is a resource page. So we follow Access very closely. We meet with them, we get information from them. We utilize their website. And so certainly you all can do the same. Access has a whole page on their website dedicated to the return to regular renewals. It has information about what members can expect. It has toolkits available. It has resources. We generate all of our materials and all of this messaging straight from the Access toolkits. We wanted to follow that because it's a network-wide, statewide initiative. So we all want to make sure that we're giving consistent messaging. So all of our materials are based on this Access page and what Access is providing the community for information. But again, certainly you guys can go and check this out if you're looking for information on the return to renewals, or excuse me, return to regular renewals. Next slide, please. And then just a couple of additional resources. So we have some CMS and Medicaid.gov links here that talk about the unwinding and return to regular renewals as well. If you're interested in learning more, certainly you can visit those and check it out. These are a couple flyers that we have available for both our Care First and Arizona Complete Health Complete Care Plan line of business. If anybody wants copies of these, my contact information will be at the end. Certainly you can reach out to us and let us know. We'd be happy to share these with you. We have a couple for providers, but we also have some direct member facing flyers. So if you want to take these and put these in your offices or in areas where you get high flow of people coming in and out, we'd be happy to share these, and certainly you can use them. And again, these are based right off of the Access flyers and Access toolkits. So if you want to use the Access ones, you can go to that Access return to regular renewals page and get flyers from them as well. Next slide. All right. And that's all I have. So certainly I'm happy to answer any questions, but both my contact information is there, and Sun Young Pak is my counterpart in the Care First side. Her contact information is there too. If you have any questions after this presentation, we'd be happy to answer them. So please feel free to reach out. But I will pause real quick to see if there's any questions.
Hi, Allison. I do have a question. Alyssa, do you want to unmute and ask the question?
Okay, I'm trying to unmute. There we go.
There you go.
Sorry about that. Hi, Allison.
Hi.
I'm Elisa Chutinsky. I'm the interim executive director of Northwest Valley Connect. So my understanding is there are some transportation service providers that do get paid by Medicaid/Access to provide essential rides for medical appointments and dialysis. How would we do that? Does that happen, and how do we do that?
Yeah, I do believe, I know we have some vendors that our providers have to go through and utilize, or our members have to go through and utilize, but I think there might be some other kind of transportation contracts we have in place. So are you wanting like connections to them? Are you wanting to maybe have them utilize some flyers?
No, I would like to have a earned revenue stream for what we do. We provide rides for veterans and seniors and people with disabilities throughout the Northwest Valley. And it would be certainly wonderful to have an earned revenue stream by providing that and getting paid to do that instead of going out and trying to find grants and begging for donations all the time.
Yeah, so I think if you're interested in looking to get specific services contracted with either the Arizona Complete Health or Care First plan, definitely check out our website. There's a whole page about setting up contracts and doing like a potential provider application there. And I would encourage you to fill that out. And I can put our website's links in the chat here at the end too.
That'd be great. Thank you.
Yeah, for sure.
I believe Sam had a question.
Yes, I just wanted to follow up on that packet of materials I saw on one of the, I think it was the last slide or the one just prior to it. I'm curious if we could pick some up to hand out to our passengers.
Yeah, absolutely. So I can, what I can do is I'll send a copy of the flyers to this group afterwards, or to Hezekias. Maybe you can help distribute that out. And certainly you're welcome to use those as you like. So if you want to print them out, hand them out, perfect. Again, Access has a version that's very similar, so you're welcome to do that, but we would love to have our health plan branded materials out there as well. So either way, I'll make sure that you get our flyers, and then you have the link to the Access page if needed.
Thank you. Are there any other questions? Either raise your hand or put your question in the chat. Definitely, thank you for this information, especially for the providers here today. We seen the messaging. Well, I've seen the messaging and I've talked to other stakeholders. And one of the things that really struck out to me is their messaging of making sure that the people that you work with open their mail. It's as simple as that. For that renewal information is to open your mail. So and definitely we are working with the most vulnerable in the population. So, and I know how important it is that I have continued coverage. We want to ensure that our consumers don't have that gap in their coverage. So again, thank you so much for your information. All of our resources, any of the materials that the presenters forward to us, we will make sure that they're uploaded on our website. Are there any other questions? Allison, you did a great job. Mauricio, I saw that you put the link to the renewals in the chat. You did a great job, great information. Thank you very much for being here today.
Thank you. I appreciate this group's time.
Okay, thank you. Well, there's a lot of information. I'll make sure that we take care of ourselves. And I just noted that the temperature is 104 today, and we expect to be at 110 Saturday. So I would like to bring up our next polling question. Are you aware of the heat relief program prior to today? A yes, no, or unsure? I know there's been a lot of media coverage on our rising temperatures. And I just thought I recently heard that our monsoon is coming sooner, but is going to be drier. So we might not get that little relief that we do with the monsoon season. So I think this next present agenda item is very current. Okay. And we'll bring up. So I'm really happy to say here or see that 64% of you have heard of the Heat Relief Network. 25 have not, and 11% unsure. So I would like to thank Samantha Johnson, Sam, for being here today to provide some information on the Heat Relief Program and Heat Relief Rights. Sam, thank you for being here.
Thank you, Dee Dee. I appreciate that. Hezekiah, so should I go ahead and bring up our website or just a
Yes,
quick?
you can do that. Yeah.
Okay. Just to quickly give some context. I am with Elaine Transportation. We're a small nonprofit based on the Human Services Campus in downtown Phoenix. Is everyone aware of the Human Services Campus? Actually, I shouldn't.
Yes, I am.
Wonderful. So we are focused on providing transportation equity by enabling access to all other social determinants of health. So we provide transportation in general to healthcare appointments, to food access, to the MVD to get an ID, to get to buy a phone. So we are really, really focused on providing transportation for the most vulnerable populations among us. In one of the presentations earlier, they were talking about Medicaid churn. We see things like basic ID churn, basic phone churn. You know, people are not able to hang on to these basic documents or pieces of technology that would normally enable them to access transportation through the bus system or through, you know, anything else that's available. So when we're talking about people accessing heat relief, it really, really is a challenge for the most vulnerable people who are out here in the tents every day. Just again, to give context, we're seeing people, we're seeing fire trucks, we're seeing ambulances every other day visiting these tents out here right outside the Human Services campus. So Zacchaeus, if we could go ahead and pull up the slides on the heat relief network and the heat, kind of the it's a little bit morbid, but basically the heat mortality. This is just one of our old infographics. So this is MAG's Heat Relief Network, and as you are all aware already, these are the locations. These are the physical locations where people may go and get relief from the heat. These are open. These are libraries. These are churches. These are many individual locations that have opened their doors and allowed vulnerable people to just enter and get some relief from the heat during open hours of the day. Now, there are some challenges around this. These are not always open well into the evening. And on top of that, people need a way to get there. They can use the metro system, or if they don't have access, if they don't have a card, if they're not able to keep their card, they can call Elaine or they can call Ride United. Now, again, we're seeing barriers around this where people either don't have a way to contact us, or they just don't even know that this resources exist. They don't know that the Heat Relief Network exists. They don't know that they have a way to get there that you know, will be point to point and no cost. So next slide, please. This is the most recent point in time count. We're looking at, you know, approximately 4,500 unsheltered individuals who are in this 100-degree heat, 105-degree heat, 110-degree heat, day in, day out. If you go to the next slide real quick. Actually, the next one after this. We're looking at 80% of deaths from outdoor heat exposure. I'm sorry, 80% of the deaths from heat exposure are outdoor deaths. 54% involve substance use. So when we're talking about really, really addressing the crisis, the health crisis from heat exposure, we're talking about meeting the most vulnerable people where they are at and in the condition that they're currently at. So if we're looking at the last couple of years of data, and the link right here, if anyone's interested in looking at the specifics, the top zip codes where we're seeing the most heat-related deaths and the most heat-related symptoms are 85007 and 85034. Now, I can tell you from personal experience and being right here, that's the Human Services Campus and the Washington Street Shelter. So there is an opportunity here for us to really, really focus our transportation services on this small area and to figure out how to connect these most vulnerable people with the resources that already exist. If we go to the next, actually 2 slides forward. We're looking at collaborating with street outreach more directly. We're looking at collaborating with free phone pop-ups. So the barriers that we're seeing, if we could go back 1 slide, and thank you, Zacchaeus, for accommodating my skip around style here. We're seeing people without phones, without internet. We're seeing people who worry about the cost of a ride. Even a $2 reduced fare bus pass is too much. And we're seeing people who have no way of accessing information about resources. On top of that, we encountered a barrier we weren't quite expecting with these rides. We're encountering people who don't want to leave their stuff. People have everything they own in the world with them on the sidewalks here. And if they leave it, it's gone. So we're encountering people who are willing to endure 110 degrees in order to not lose their entire life's worth of belongings, which is an interesting, it's an interesting conundrum. And we are, if we can skip forward again, thank you, Sekis. We're looking at ways of offering more in-place heat relief in those circumstances. Literally just delivering people water, offering them 20, 30 minutes just to cool down inside the vehicle parked next to their encampment. You know, it retains that sense of security. It's meeting people where they're at. And it is also offering a little bit of that preventative heat relief. It's nowhere near enough, but it's a little bit of a respite. And if we may go forward, I'm trying to recall if there's one more slide. So for Elaine, let me give a little bit more context on this. I mentioned at the beginning that we provide STOH transportation. Heat relief is obviously a top priority for us given the populations that we serve. We are available by phone Monday through Friday, 8 a.m. to 5 p.m. We're not the only transportation available for heat relief, but we are the largest in the city. I was surprised to find out. We and Ride United are the two I know of that provide this type of transportation. So for context, in 2022, Ride United, I believe, provided about 1,200 rides total. We provided 4,128 rides with our 2 vehicles and then 3 vehicles that we grew into. Now in 2023, we have 5 vehicles total. So far between January and May, we've provided 3,304 rides. Now that is all STOH ride types. That's not just heat relief, that is everything. So we're really, really encouraging people to reach out to us if they have a need, especially like even before it becomes an emergency, even before it's like a critical need. We want to provide preventative heat relief rides to get people to those cooling centers when it can still make a difference. So we're really, really, we're trying to make sure that people are aware that this resource exists, because we're trying to reach a population that's by nature very, very difficult to reach. All right. I realize that was a lot. Please let me know if anyone has any questions here. I would be delighted to answer whatever I can and anything that can help serve the passengers we serve.
Thank you, Sam. Well, maybe people are thinking of the questions. Great resources, great information, especially for those providers. This is a great resource. If you do get possibly a consumer asking some questions, definitely something has a resource that you can keep with you. Do we have any questions either on the chat or if you want to raise your hand? And is the services located in the Phoenix metropolitan area?
Yes, so we are based on the Human Services campus, and then officially we have a 15-mile radius in every direction from our main office. We, for the heat relief rides, we try to focus that a little bit more central because again, we're seeing the most need centrally. So we put a 5-mile radius on our heat relief rides, but to be clear, if somebody calls in from Dunlap and they say that they need to get out of the heat, like if their AC is broken, we're not going to deny that ride. We will make exceptions to distances in any given situation as long as we can fit it in our schedule with our 5 drivers. Again, for us, it's literally just a matter of how can we allocate these few resources to assist the most people.
Well, thank you. Again, we will have all of this information on our website. So Sam, thank you so much for being here and providing these resources.
Thank you once again for having me. And I really, really appreciate everyone's patience with me jumping around on the slides. It's this is all I've been thinking about this summer, so I appreciate the opportunity. Thank you.
Thank you. We're on to our next agenda item, and this is a time when we want to spotlight the great work that you do. We know you and your agencies are on the front line providing services to the consumer in our community, and we would like to share an agency spotlight. So today we have Steve Nath and Irma Lamas, who will provide an overview of the programs at Hope Inc. So welcome.
Thank you, guys, and bear with me because I'm having internet issues. So if I sound stunted, it's because things are slow here. Hope is been a long-term provider in Southern Arizona. We started out as a what they call a drop-in clubhouse model, where people would come and spend some time, get some respite. And over the years, we've added programming and added counseling and added outreach and so many other services that really become a different animal that we're pretty proud of, and we feel like Hope is a key partner for members to help get the services that they need. Next slide. I've never done a presentation like this, so bear with me. Hope's mission and vision is really just to make sure that we have recovery-based services available to whoever needs them. Whether they have access or not, we'll try and help them get access. If we can't get them connected with access, connect them services that can provide them those services based on insurance that they have or programs that are available for those people who are in that flux where they don't have insurance. Probably one of the strongest things about Hope, next slide, please, is that we're a peer and family run organization. And basically what that means is that everybody from the staff, the management, even our board of directors, we are either a peer or we're a family member of a peer. So there's a lot of lived experience, which means we don't really know everybody's exact story, but we do have an intimate understanding of the difficulties on the road to recovery and to responding to mental health needs. Next slide. A consumer operated services really is got a long history. Most people don't know it, but the first peer run organization started back in the late 1700s and then really became popular when Bill and Bob started the 12-step movement, which is really just a peer support grassroots organization. But the beauty of the peer support model and the consumer run services is that we understand that journey, and it helps our members feel more welcome and less stigmatized because we're aware of the journey that they've been on. Next slide, please. So one of the things that we're really proud about is we were labeled as a center of excellence by Arizona Community Health, and it's really because we provide that extra level of service. And I think it's because of our members on the front line, our staff on the front line who are working with members, and our leadership who is willing to do whatever they need to support those staff so that we can get out there and do that work. We do a lot of outreach on top of our basic site services, and that outreach really is, some of our folks are just out in the trenches, walking the streets, connecting people who need help, even if it's just providing a Narcan kit or connecting them with services or helping them find shelter. That's a large part of who we are, is our outreach and our commitment to those in need. Next slide, please. Okay, next slide. So Hope's center-based services are probably the backbone of all of our sites. We have 5 sites that are full service centers, and then we have 4 more sites that are just getting started, where we have co-housed offices with other agencies, and slowly but surely we know that those areas will grow. But we provide peer and family support, life skills training, we do employment services, we have day programs where folks can come in, spend the day, make sure that they have a breakfast and a lunch. Sometimes that's the meals those folks get for that day. We have diversion services, do individual and group counseling, and because of the pandemic, we were able to reinvent ourselves, where you had to come in to do group counseling. Today, you can be in Yuma, and if there's a group that's going on in Prescott that you want to attend, you can zoom into that meeting, be a part of that group. So it's no longer based on what's being offered at a particular site. We now are able to get into a group that meets your schedule and your needs, because we've had to grow and become more technologically advanced because of the pandemic. So the pandemic slowed us down, but it actually made us a more, it helped us be able to provide more services. We helped our members get smartphones so they could dial in phones and things like that. So while it was sad that we went through the pandemic, I think there's quite a few agencies that came out the other side better for it. Next slide. This is gives you a little bit of an idea of how many people we serve on our center basis. Cochise County, 255. Pima County is our largest, with 529 members being served there in the last fiscal year. A huge amount in Santa Cruz County and Yuma County. We are also serving members in Pinal and Maricopa now, and Navajo and Yavapai. We don't have those numbers yet, but I know next year this pie is going to look a lot different. It's one in so many places. Next slide, please. Some of our community-based programs are the peer and aftercare team, and that's sort of second responders. Criminal justice programming, we have a huge criminal justice influence or partnership, really. We are working with mental health court, we're working with diversion programs with probation and parole. Our substance abuse outreach, which we do in partnership with Arizona Community Health. They provide us with substance use outreach support, and that allows us to really put boots on the ground and put people where we need to connect with those who are in need of services. We also have a huge warm line network. Today we can proudly say we not only have English, but we have Spanish speaking warm line available throughout most of the day on the weekends. And we service and support quite a few people through that warm line. So it's not like a crisis line, but it's more like that storm before the crisis support. So maybe we can help people not end up in a crisis situation. Next slide, please. So the peer and aftercare team, like I said before, is really a second responder. So if somebody's coming out of treatment, they're coming out of some other long-term incarceration, we can help connect them. They're coming out of crisis as well. We can help connect them with those services, because that immediate time right after that crisis or that transition is really an important time where a lot of support is necessary, where we can make sure that folks are getting connected with the services they need, making sure they're having basic living skills met, or living needs. And that's an important piece of everyone's success, is if they can get those basic skills or basic living needs met, we can really help them be successful. Next slide. Our criminal justice programming, that's one of the things that we do everywhere we're at. It's probably one of the things that we do really well in the Maricopa, Apache Junction, Mesa, Pinal County area. We actually have folks housed at the jail, their office there, and they're officed with our parole and probation. And we don't have center-based services there yet, but we can provide almost all of the same services, just it's done individually, and we're meeting people right where they're at instead of having to come into a center. But we work closely with those being released with prison. We help them get IDs and social security cards. We connect them to integrated health to make sure that they're, getting their mental health needs, their physical health needs met. We go out to Phoenix West and to Perryville to participate in the Second Chance program there, which is an 8-week program to help folks get their GED. They can do trade programs, learn coding and HVAC and stuff like that. And then we provide community support through like the TIP program as well, same venues. Next program, or next slide, please. This gives you a little bit idea of the folks that we serve in that. It doesn't really have the Maricopa Pinal County slice in there, but I know it's a very large slice, and I want to say it's somewhere in the neighborhood of 11. Do quite a bit of work with those coming out of the prison system, or being able to divert those who might be going into the system through the parole offices. Next slide, please. Outreach and through the substance use grant is probably, again, one of the things we do, in my opinion, as well as we possibly can, just really out there meeting the people where they're at. The 4 guys that you see pictured are our outreach programs manager, our senior chief, and our clinical director, because everybody gets involved in it from the top down. It's not something that just a set of folks do, but everybody who works for Hope is part of that outreach. Next slide, please. So these are the folks that we've helped through that SOR grant. And this includes getting them engaged in services, or just talking to them, giving them Narcan kits and stuff like that. This is our warm line folks. And again, we're open 365 days a year. They're open most of the day. On holidays, they're even open. We just want to make sure that there's somebody there if somebody chooses to use that warm line. And we've actually reached out, or a lot of people have reached out to us. Next slide, please. So over the course of the fiscal year 2022, we dealt with 106,000 calls. So it's quite a bit of, there's a lot of folks that we reach through that warm and help connect them to services, or just help them reduce that crisis situation that they're in. Next slide, please. We also do peer support training. So not only do we have classes for our own staff as they come on board, but we also provide it for members out in the community. And they don't have to be a member of our agency. They can be a member of another agency, but if that's part of their recovery, to learn about peer support training, and we're willing to help get them trained and help them go through the program so that they could do the work that we want. I think I'm proud to be part of that 20%. But there's a solid block of our staff who actually started out as members and then became staff after. Next slide, please. And I didn't want to not talk about transportation, because we are sort of transportation. But when we talk about how things have changed since the pandemic and stuff, so from 5/21 to 4/30/22, we logged about 93,000 miles across all of our sites and gave rides to about 7,000 folks. In the 12 months from 5/1/22 to 4/30/23, that jumped threefold, and we logged about 281,000 miles, giving 19,000 members rides. What that doesn't show, though, is also the roughly 28,000 miles that we've done in outreach, providing folks rides to the programs that they need, to the services that they need, getting them to court, getting them to the health department or to DMV to get an ID card and stuff like that. Next slide, please. So this kind of gives you an idea of just all of the folks that we've helped across all of the different programming. And again, the criminal justice has just been growing quite a bit. It's part of who we are now, instead of like in the beginning we were trying to gain traction. It's really one of Hope's focal points now, along with its center-based recovery. Next slide. So we're also expanding north. In the last year, next slide, we've moved into we've moved into Cottonwood, Camp Verde, Prescott, and then where we've moved up in those areas is with Spectrum Health, and Spectrum Health is also bringing their medical piece down to us in the southern part of the state. We are also in Show Low, Arizona now, and we're looking at a stick built for our offices, but we're housed in the emergency room there in Show Low, so that we are connecting folks in crisis to services in the moment versus waiting for that referral to show up. Slide. And then this shows all the areas that we're in, but we're also, like I said, housed in, two folks housed at the prison in Florence, and then where we were in Pinal County, which is we're on Apache Trail, which is right on the Pinal-Maricopa border, and John now is housed right down the street with adult probation and parole. They said, let's get you right here so we don't have to send people, they don't get lost on the way. We don't have to worry about transportation. This way they can come right out of the parole or probation office directly to staff, so we got connect them to services out of the gate. And that's pretty much who Hope is. I know I went through that fast. I'm better with numbers and data than I am with saying who we are, but that's Hope in a nutshell.
Thank you. I think you did a great job, Steve. So definitely, thank you. We do have a question from Sam.
Hi, Steve, if I may. Wonderful information. May I just ask, are your transportation services only open to people in recovery?
Well, they're open to our members, and then through our outreach, it's open to those who need that in order to get connected to the services that they're looking for. All of our sites have regular vehicles, but also have paratransit vehicles, so that's, we don't want to either we have handicapped lift vehicles or we have ramp vehicles, but we want to make sure that it's not served because we don't have the right tools to do it well.
Do we have any other questions, or I'm just checking chat to see if there's anything in here. Steve, I think you did a great job. Thank you. Thank you for the services that you provide to the community. Your program is one of the ones that really reached kind of the outlier consumers. And thank you for really expanding, and you're almost covering the whole of the state. And I know you are a partner in the MAG area, so thank you so much for your information.
Yeah.
Okay, thank you. We are really close. We have one more item on the agenda. So before we move forward, we wanted to ask this question is, how would you like to attend future TAP meetings? And I think this is an appropriate question because it just went up a degree. So now it's 105. So would you like to continue meeting virtually? Would you like to meet in person? And it would be at the MAG offices in downtown Phoenix. Would you like to have the option over of being a hybrid meeting, either meeting in person or virtually, or you're not sure at this time? So I will give you a couple of some moments to answer, and this will help us as we start planning for future TAP meetings. We also want to ensure that you as attendees are in a safe environment too. Yes, as we reach that 1 degree higher, 60%, more than 50% of you said definitely continue to meet virtually. And I know just looking at the list of names here that come all the way from North Phoenix, you know, Northwest Valley Connect in the West Valley and Mesa, meeting virtually is an option. It will continue to be an option. In person, we may, look to see if there's an option to do an in-person, but having that option of either having a hybrid meeting at some point is something that people are interested. 28% of you are interested, and again, there's 4% not sure. So thank you for providing us that information so we can start planning for future TAP meetings. Regional Human Services Transportation update. I just have a few. I will keep this short. It's just a reminder, as Wendy had mentioned, that the priority listing for the Section 5310 project requests are going before our MAG Regional Council tomorrow for recommendation of approval. We should have that outcome tomorrow afternoon, and the word letters or notification will go out after that. Yes, definitely. Virtually is, DEC said virtually is best, especially for the long commute and drive, definitely. And thank you for that comment. And a reminder for those of you who are 5310 subrecipients, it is a federal requirement to participate in coordination, such as attending this TAP meeting, also providing feedback on human services transportation, feedback on barriers, challenges, and some best practices. So the sub-regional mobility sub-regional mobility manager has will be presenting next after this. So this is a great opportunity to provide your comments that drives the topics that we will work on throughout the year. And I highly suggest and recommend your participation in their focus group chat. Also for those, another update regarding 5310, there is a new designated area in our region called the West Phoenix Goodyear Avondale urban area. And this would be Southwest Phoenix metropolitan area. What this means is that the West Phoenix Goodyear Avondale area, or WPGA, will get 5310 apportionments for that designated area. I will provide further information at the next TAP meeting as we go into the next application cycle for 5310. But I just wanted to mention this to those agencies that may, or if you know agencies, or if you are an agency that provides transportation in that West Phoenix, Goodyear, Avondale area, this may be a funding option that you would be able to participate in. Again, I will provide additional information as I receive additional information at our next TAP meeting. And so I would like to now hand this over to Ezekias to take us into the Sub-Region Mobility Managers update. Ezekias.
Hi, Didi. I'm trying to get my computer to work in here. It's extremely slow, but thank you. And before we get to the sub-regional mobility managers topic, I do want to show one more polling question. And that one is just for you to choose from the following topics, which ones your agency have faced challenges in the past. So we're looking for the recent past, if you have had any of them, and you can choose more than one. This is just going to help us with our mobility managers topic as well. All right, and we have the results. It looks like a lot of you have had issues with staffing concerns, and we have heard in our previous meetings and all workshops and trainings we've had, this is one of the most pressing issues that you've had, with 90% of the people that answered saying that they had staffing concerns, followed by fleet maintenance at 35%. Section 5310 data collection and reporting support at 20%, then transportation program and coordination guidance at 15%, and then driver training at 5%. All right, thank you so much, everybody that answered. And the reason why we asked of you of what areas you have had challenge in the recent past is that our next topic with the mobility managers, we were going to divide into 2 breakout rooms where we're gonna want to hear from the mobility managers and also from you, the participants, on these challenges. We wanna hear a little bit more in detail on what those challenges that you're facing are, so we can see how the MAG team, as part of the 5310 program, can support your agencies and through the mobility managers on these challenges, how the mobility managers can step in, and who knows if it's creating focus groups, workshops, trainings, so that we can help to increase the productivity of your agencies and dealing with these challenges. So based on your answer, I'm going to open 2 breakout rooms, all right? And bear with me because, as I said, my computer is lagging a little bit, but okay, there we go. The breakout rooms is going to be in the room number 1, we're gonna have fleet training and compliancy challenges. So if you answered for the 3 first options in there, feel free to join that. That's what is going to be discussed on that specific room. And then for room number 2, we're going to be talking about staffing and programs. The way that you can join these rooms is that I'm going to open them now, and the 2 options are going to show in your screen for you to join. So once you join, you're going to be in a room with the other mobility managers, and they will be leading the conversation on those topics and helping you share a little bit more and sharing their challenges as well, so we can use your insight on those challenges as we move forward on planning our 5310 program here at MAG. So I'm going to open the room now. You should see the option to join one of the breakout rooms now, and please join as you wish, and we're gonna have more conversation on these rooms in a little bit. With the people that stayed in the main session, again, you're welcome to join any of the two breakout rooms, but you can also just wait in here until the breakout rooms session is completed, and then we'll be back here in about 15 minutes. If you have issues joining one of the breakout rooms and you need assistance, you can also just unmute yourself or put it on the chat and I can help you with that. You can put in the chat which of the two rooms you want to join and I will direct you to it.
And with that, our breakout room is closed.
So
Hello,
as
everybody.
I know, I'm sorry, but I wanted to go just a little bit longer. We had some really good good discussion going on.
Unfortunately, to bring out the groups back is going to be a little bit more complicated, but why don't we do like this? Since you're having a good conversation, you bring it back to the entire group right now, and we can continue the conversation and also use it as a summary for the people that were not in the group to also see what was going on the groups that they were not able to attend. So we'll
That's a
start with
great idea.
your group,
Okay.
Didi, Justine, and Dawn.
Definitely. So we were in group 1, and Justin, I don't know if you want to do the summary. Would you like me to do the summary?
You can, Didi, it's fine.
Okay, thank you, Justin. For our discussion, we were talking more about fleet management, and Justin had brought up that he's been hearing from, and I'm sure everybody can relate to this, the rising cost of just getting the parts for your vehicle, and how can we help with that. He did mention that at this time there used to be 6 service providers that would work on Lyft services. There's now 4. With the suggestion and help of Wendy, we are going to develop a resource list of those services, what do you call them, maintenance people, that will make available on the Mobility Manager's webpage. So that's something. It was also the Mobility Managers, Billy and just to let you guys know, they're also going to look at other avenues of services that will help with fleet management and possibly kind of do a quasi brokerage of, reaching out to agencies that provide services and see if we can get kind of like a pooling of resources that provide services for your vehicles. So we're looking at that. One of the challenges that I heard was that, you guys are from nonprofits and you're not doing this the work for the money. So, the rising cost of providing of maintaining your vehicle is very costly, and needing a break in the cost of services, and letting those service shops know that you're from a nonprofit, you're from MAG, a regional a regional organization providing community services to the vulnerable, and how we can develop some best practices, and maybe kind of work with that, as if we come together as a group, that does go, thank you, Zacchaeus, come together as a group, it's better than one person coming in and looking for services or looking at the cost. If we all can come in, together, we thought that would provide us a break. Also, that Discount Tire is a resource, not only for tires, but I think it was Yale that said they also do windshield wiper blades. If we can use them as a resource, and I think, well, I don't know, I haven't let Justin know, but maybe he can pull together a best practice page on the services that, we can provide to the group. Overall. So I, really am thankful that Wendy, in our little small group of Dawn, Sam, Wendy, Yale, Kim, and Lahara, for providing some input on that. But we definitely have some things that we're going to work on that we can hopefully share at the next TAP meeting. So thanks.
Yeah,
Did I miss anybody from the group? Oh, go ahead.
I was say one of the biggest things I would, don't be afraid to ask for a discount. You'll be surprised how many vendors out there, when you let them know that you're a nonprofit and that you're part of the MAG community, how they will, offer you, if you ask for it, a discount. I mean, I've received, at one point, 60% off services. Just recently I received 40% off services. So as long as you're willing to ask for it, it never hurts to ask. I mean, the worst I've seen so far is a 10% discount. So so just don't be afraid to open your mouth and ask for it. Let them know that you're a nonprofit and that you're in with the MAG community, and it's going to help you in the long end.
And if you get super, super organized and, 4 or 5 of your agencies want to talk and get together and ask at the same time, you could probably pre-negotiate some even larger discounts if you said, hey, well, we've got 20 vehicles in our fleet. Well, we've got 15. Well, we've got 5 and we've got 7. And those agencies go together. You have a pretty darn large fleet that you could maybe get a combined discount, together for lots of different things.
Absolutely.
All right. Thank you for the room number 1 for giving a summary of what your conversation was in the breakout room. And then I'm going to pass it on to Travis and Billy on room number 2 on what you discussed on your breakout room.
Okay, so we got into a conversation about personnel, and really recruiting and retention was more than anything. And we were really talking about, strategies for not only outreach and finding potential employees, but what is it that makes an employee want to stay with your organization? And and looking at various situations, and occasionally I had mentioned talking to other providers at times that would tell me that they don't have any vacancies, which is like, I don't know how they do that. I want to be drinking whatever they're drinking for sure. And so anyhow, that was one of the things we talked about. We talked about some experiences that our organization had where we were offering really significant bonuses for a period of time, and then we offered an increased salary, and we got like 5 times as many people when we offered the increased salary. However, if a person were to do the math, they would find out that the bonus would have been much more profitable in the long haul. But so it kind of leads you to sort of be thinking about, kind of get into the psyche of a potential employee and what it is that they look for, and maybe how they compare organizations against each other as well. And so, that was some of the stuff we talked about. There was one person that was in behavioral health that really, Steve, I think his name was, he was really talked about burnout and how much of a challenge behavioral health is on people, and maybe they come into the job not realizing how intense it's going to be, and then they burn out. So that creates a high degree of turnover as well. That was one thing that was mentioned. Again, we talked about, also like rewards programs and employee of the month kind of, like incentive programs and things like that with people as well. And then a little bit also about, demographics, particularly women in the workforce, and how, the statistics are about the fact that there's more women in the military, more women in college, more challenges with immigration issues federally, which can have an impact on the kind of work that we do. So, it was really, we had just started to really crack the ice on the issue and to really talk about it. But there's just a lot of unanswered questions about that. And I think it's sort of a moving target as well in terms of, how that all changes. So, Travis, anything to add?
I think that we may have lost Travis.
Okay.
But yes, thank you so much, Billy, for your summary of the room number 2 discussion. I think it's also some things that we need to be looking at when we are looking at ways to assist our subrecipients and the providers, the human services transportation providers in general in our region. is how to deal with this issue of staffing turnover, and how we can address that in a long term, right? Because what it looks like is like in the short term, you can provide bonuses and signing bonuses and other offers, and then they might come. And from what I heard is that they come the moment that they get that final bonus payout, they leave looking for the other bonuses. So how we can address that, I've just been on the CTAA conference, and we were talking about hiring more people that are like-minded to your vision and mission of your agency. So there are some strategies that we're going to be looking on ways of sharing that with you on our workshops and trainings moving forward. So stay tuned for that information as well. I want to open up to the rest of the room. Is there any other comment based on the discussions that we had that you want to have, since we are coming to the end of the meeting?
This is kind of a tongue-in-cheek comment. This is Wendy. I just want to say the city of Phoenix is hiring. Come work with us and we have a defined pension. Just kidding.
Yes, I think this is such a big topic. I'm just thinking off the top of my head that I think because these breakout rooms where I love the dynamic of the dialogue that we just went through. So I'm thinking possibly, I'm thinking focus group on a larger scale for staffing at least, because 90% of those attending today said this is an issue. And I know we kind of, Billy, you mentioned it in some of your trainings, workshops, and I've heard it in other workshops, but I think maybe having an hour dedicated, just, sharing ideas, maybe Ezekias can pull together some best practices on that. So I'm just thinking this might be a focus group on staffing. And
Like that idea.
yeah, and you brought up a really good a comment, and Ezekias brought the same kind of comment from when he went to CTAA, was that it's not, the money isn't drawing the people in. It's rethinking that, and thinking of the people who want to look for jobs that serve a purpose. So I think the messaging of marketing these open positions have to change, have to change a little. So really good conversation. Anything else anybody would like to add before we end? Okay. And definitely thank you all for the work that you do. We really appreciate you. You are on the front lines. Thank you for spending your time with us. For those who just held out on the last couple of minutes, thank you. And for those that did, participate in the work in the breakout group. So we do have your attendance. So thank you so much. We appreciate it. Thank you. Ezekias, anything you would like to add?
I just want to say thank you for everybody who attended today. And thank you so much for participating on our TAP meeting for June. And look for all the flyers and all the resources that were mentioned today. If they were in the presentation slides, I'll be sending a link for you to access them soon. And if they're not in the presentation slides, we're also going to be adding it to our TAP website for the flyers and other information that was shared here today, so you can have access to it.
Thank you. Have a great afternoon.
Thanks a lot. Appreciate it.